Good morning. I'd like to welcome you to the Board of Health meeting. So we're glad you're here. We'll look forward to your public comments in agenda item 8. So Kim has been passing out information or an informational sheet for public comments. It helps us to be able to send you information in response to your public comments, as we will not be responding to them at the time when you make the public comment. So, all right. So the first item of business is the approval of the minutes that you have before you that Kim graciously wrote up from September 1st. So we have a motion for approval. We have a second. Any discussion of the minutes? All right. All in favor?
Aye.
Opposed? Motion carried. We have some vouchers, and Jen, will you talk a little bit about what we're seeing?
The vouchers were emailed out, and if you have any questions, we can reach out, but generally it's business as usual, so no surprises.
Okay. I like no surprises. All right. May I have a motion for approval? So Ray has made the motion. Linda has seconded. Any discussion on the vouchers that were emailed? All right. All those in favor?
Aye.
Opposed? Motion carried. We have 3 resolutions for the board to consider, and I'd like to take them all as one if there's no problem.
Okay. So the 3 resolutions today, the first one is for approval of a contract with Mosaic for isolation and quarantine. If you'll remember, we implemented this about little over a year ago. So this is a renewal contract. This has been a partner, Mosaic has been a partner with the health department when we have identified someone who is home insecure or at a shelter or has some other need that they are not able to appropriately isolate or quarantine away from others in a congregate setting. Mosaic is our partner for housing in that, and they provide lodging and meals. We continue to do those daily health check-ins, but has been a really good partner that has worked out really well, having that additional staff in hand. So we want to renew that contract for the upcoming year, just in case that is a need.
Just a second. We've got a couple of questions.
Oh, of course.
I'm just curious where they're lodging.
I think they would prefer if we don't say it, but
No, okay, that's fine.
Yeah.
That's fine.
yeah, they do coordinate that so that they have that listed.
Okay.
Yep.
Do we have any statistics of number of patients, is probably not the right word, just residents that they have housed for the county?
Yeah. I know in the spring, I think we had about 5, and then over the last probably couple months, maybe 2 or 3. It's not a large number, but and it's usually no more than 1 at any given time, but we have had them housed. Yep. It was a little bit more in the summer too, so we did support some of our growers in that way as well. All right, the second is the approval of contract with Spectrum Health Lakeland for tuberculosis services. This is going to feel familiar. You actually saw this, I think, a month and a half or so ago, maybe a few months ago. Spectrum Health Lakeland has updated their contract format and process, and so we're just bringing that back to have the newer contract version. It is now an electronic signature. So we want that to go back before the board just so that the appropriate way to approve that is there. Again, this supports our TB clinic and services, is an ongoing partnership. We've actually had this for a number of years. It is just putting that into its new updated contractual form. Yes.
How many cases of TB have there been in the past? I mean, just approximately.
I will get those numbers for you. I do not know them off the top of my head.
But a
I mean, we
handful
often
or
have latent TB. I mean, we have had times where we've had up to 3 or 4 active TB at one time where we have to do direct observed therapy. So I think right now we might have 1 or 2 active on, but we can definitely bring back those kind of quarterly or yearly numbers if you just want perspective of what that looks like.
Yeah.
Latent TB is usually a higher
Certainly
number.
This is not, it's not urgent. It's just.
Yeah,
I'm just
no,
curious
absolutely.
Whether it's a couple or a larger number.
Yeah, well, and when we've had a couple or more, that does put a lot more strain on our public health nurses. And unfortunately, that always seems to happen when we have a lot of other clinical needs happening.
Right.
And because that direct observed therapy just requires a lot of travel time and in-home time. Yeah. All right, and the final is a user agreement. So approving a user agreement with Smartsheets. So this is new. Smartsheets is an online Excel-like platform. So if you kind of think Google Excel sheets, it's similar to that. We have just over and over the last couple of years really identified a need for a better platform to have two-way sharing. An Excel spreadsheet is static. Once it leaves, we can't co-edit, we can't do those things. So in partnership with IS, we're able to vet what tools might allow us to do that still maintain confidentiality and HIPAA compliance. Smartsheets was one of those. We did work that through the county finance committee. For its cost, it is an annual fee, and that is noted there above $19,500. We are initially using that for COVID-19 response activities and being able to support congregate care partners and school partners and being able to have more real-time data sharing, as well as it will allow us to do different things like forms on our website that can feed directly into an Excel spreadsheet that we can then co-author and work on in the department, which we have really learned with COVID-19. We knew this before, but having static spreadsheets and all needing different numbers and being able to share those at one time is just not compatible. So we do have the opportunity to enter into this user agreement, use this platform. We're really excited for that. I think it actually will have much broader applicability to public health work. And so we would like to move that forward. It will initially be for COVID-19 and covered by COVID-19 funding that we have received from the state of Michigan.
All right. Any questions about the 3 resolutions that have been presented?
This Smartsheet, is it an annual renewal or is it something that we own after we?
It is an annual renewal, so it's a month-to-month platform. So if we don't care for it, we don't have to renew it next year, but it is paid for an annual, for a 12-month period. So it will cost that year over year, yes.
If we do not renew it, what happens to all the data?
We would retain that. We would be able to download those like we would any other static spreadsheet for record keeping. And we just wouldn't have the two-way sharing on it. Yeah.
All right. So you have 3 resolutions in front of you. May I have a motion for their approval? So Dr. Edwards has moved. Vanessa has seconded. Any discussion? All those in favor?
Aye.
Opposed? All right, motion carried. Moving on. This is the Jen show, isn't it?
Okay, so we are going to review the financials as of August 30th. Okay, so for state and federal grant revenues received through the end of August, they total $4.3 million. And that's about 29% over budget. And it's $1.5 million higher than last year. And that's primarily driven by the COVID funding that was received at the health department. We're seeing permits and inspections favorable to budget by $114,000. And that's also favorable to last year by $55,000. And that's a result of septic tank revenues being higher than what was expected. Medicaid, Medicare, and private insurance and clinic revenues are unfavorable to budget by about $58,000. And that's down $31,000 compared to last year as well. That's That's primarily driven by the reduced traffic that was in the clinic as a result of COVID. And then Medicaid Title 19 reimbursement is $138,000 favorable to budget, and this is primarily driven by carryover, so that will reduce as well. Related to expenses, we're seeing in direct expenditures in total $526,000 under budget, so that's a favorable number, and that's before the county allocation. A majority of that is driven by the personnel expenses related to the COVID hotline, contract tracing, and vaccine clinics. Personnel costs, including both salary and benefits, are just over $400,000 under budget. This is a result of the benefits are budgeted at the fullest potential benefit rate, and we've had a number of vacancies that I know Courtney's going to talk about later. So those are the two contributing factors for that. Medical and program supplies are $137,000 favorable to budget. That's timing driven, so that's going to diminish. Contractual services are $54,000 unfavorable to budget. That includes the Sable contract, the communications contract that was put in place a while back. Travel expenses are $34,000 favorable to budget, primarily driven by the travel restrictions as a result of COVID. Software maintenance expenses are $11,000 over budget. Again, that's timing related because of when we pay the annual Patagonia maintenance agreement. So what we're seeing in summary is revenues exceed the budget by $1.3 million, and expenses are favorable to budget by $526,000. Therefore, we have a $1.8 million favorable variance to budget.
All right, are there any questions on the budget? That was a very smooth presentation, thank you. All right. So the FY22 budget.
All right. So today we don't have a program spotlight. We were going to do some administrative updates. I know at our last meeting, we're just at that budget time, but there was also the request for an organizational chart and just kind of an update where we are with that. So going to move through that. It will be on the slide. Sorry, in front of you is grayscale because, of course, on a board meeting morning, we had printer trouble this morning. So apologies for that for the graphs when we get there, but we can also share that out so that you have them. So one thing to note with our budget is this is still what I would consider in a draft rendition. We're still doing some of that work with county. It's of course going through county process, but I think it's a really close representation of where we're going to land. We'll continue to bring that final budget back to the board so that you have that information. So just wanted to go over some of the high level slides that we shared with the Board of Commissioners and are continuing to work from. So just a reminder, of course, our purpose and being here is to serve the residents of Berrien County to prevent disease, protect health, and promote an optimal quality of life for all. So when we look in the upcoming year, and this is looking forward, what are some of the opportunities that we really focused on as we looked at our budget? That is fostering and establishing partnerships and connections. So this first one is really about continuing to build on many of the ongoing, the new, the traditional, the untraditional partners that we have made over the last 18 months of COVID-19. We have evolved in how we partner and communicate in community. So continuing to do that, continuing to have a community presence and work with all of our partners across education, faith-based workforce development, continuing to really capitalize and move into those partnerships, to lean into them more deeply. We really want to, that second bullet, enhancing and building more equitable access to department resources and services. So there's a couple aspects in that. One, this is really where we encompass some of our desires to update our buildings and update how we are placed in the county. So we'll get to capital expenses, but looking at our Niles facility very specifically and trying to do some work there on the office side, just updates hopefully, On the clinic side, doing a little bit more reworking of that clinic space. We just have space there that we actually can't provide all of the clinic services that we would like to. Some of those exam rooms, if you've been there, they're pretty tight. So when we have like a WIC family in or a family in for immunizations, it's pretty tight to get in there. And then even to have a late night clinic, one thing we've struggled with this year is to offer all of our services on one night is really hard to do because we just don't have the space. So we would really like to think about how we update that space, how we make it more accessible to be able to have all of our services there in tandem together. The other would be our harbor country presence. Really looking at how we are in harbor country with COVID-19. We clearly have not been there as frequently. And before we were there only a couple days a week. We'd really like to have a more long-term presence there, have maybe an updated building. If our Niles is old, our Three Oaks office is
Ancient.
Vintage.
Yes.
Vintage.
very nice way to say that. So we would really like to update that space, have new exam tables, just some things that would make that a more welcoming clinic operation space. So that's really what encompasses in that bullet, really thinking forward on how do we continue to enhance and have accessible services. The third, that identify and build efficiencies, that really is encompassing things like document management and enhancement of services on our website. A lot of this, I think, will start maybe in our environmental health services area, but having a better way to do document management there. Making sure that, reports and different things could be more easily accessible to the public. There are platforms you can search records, but we have paper files, right? Being able to be a little bit more streamlined in that, as well as then that will build efficiencies for staff time. It seems like we're always being asked to do more with the same or less number of staff. So really trying to find out how can we do that more efficiently? How can we do some of that paperwork in the field? So we're limiting that desk time when you get back and you kind of have that two-way feed. So continuing to think about things like that, workforce development and management type software, just to do things like onboarding and performance reviews. So that's kind of what's encompassed in that bullet. So on the flip side, we also thought about what are some of our just risks and potential issues in our upcoming year as we move forward. And of course, our first bullet there is just still continued uncertainty around what is the ongoing timeline of COVID-19, what are going to continue to be those response needs that we need to be dedicated to and focused on, and what else might come forward. So continuing to think about that, how that impacts our department. In this year, we diverted a lot of staff time from some of the traditional work that they do. We really want to not do that as much in the upcoming year. We have lots of essential, mandated, and community need programs we operate and want to give those the full staff capacity that we can. And then directly with that is just recruitment and retention of department personnel. We're going to go over an org chart, but we have had a higher number of vacancies again throughout kind of spring and summer. Some have been filled with others to become vacant. Some have been vacant for a long time. This is just an ongoing battle for some of our positions to be competitive. But then with that is that retention piece. And I think we've talked about this, but it has been a long, arduous 18 months for many staff. And we are just continuing to think through how do we combat burnout? How do we allow staff to address fatigue and capacity and really move through that? So that's really important for us as a leadership team. We see that in our teams, and we want to make sure, we see burnout even come forward in staff relationships with each other, right? Having those shorter attention spans when we're having those collaborative efforts. So we really want to work through that together. Oh, yes.
I was just going to say that I think it's phenomenal what we're doing with the faith-based community. A friend of mine expressed to me that she wanted a booster shot. I was able to look on the computer and, oh my God, all of the churches, even my church, Second Baptist Church, I said, go over there tomorrow from 9 to 3. You can get it, And it's just like reach out and it's there. And And I can see so many potential uses for that relationship that you have established with the faith-based community. And yeah, I think that's an awesome thing that you're doing there. And I can see many, many uses. And I'm sure you can too.
Thank you, Vanessa. Yeah, we have really valued the partnerships we've built with faith-based and many other partners over the last year. We've been really fortunate to have the state mobile unit in our community a bit more and have been working to partner with them. Our clinics, we've been trying to have all of our normal clinics up and running, so being able to have the mobile partnership in and link them with faith-based partners has been really huge to do. So yeah, no, thank you for bringing that up. That has been really important. Linda.
I think implied in the uncertainty and unknown timeline for COVID is the uncertainty about continued funding.
Absolutely.
Because that is, I know that's kind of up in the air at this point. So, and that's a difficult unknown.
Yeah, no, absolutely. And we're going to talk a little about that in the next slide. So I won't go over this line by line. You have it in front of you, and we're happy to take questions. Again, this is fairly close, but a little bit of a draft form. I'll just try to do some of the highlights. We do have some comparisons to past years in there for you, as well as where we project to be here at the end of 2021, and then our 2022 proposed. I think some of the key things to look at there are when you look from our projected, right now, we have projected that based on filling some of our vacant positions. So that could be a little bit high. And of course, our 2022 proposed is based on all positions being filled all year long. That is where we want to be. We understand the reality that that might not happen, but that is how we have formed the budget of a fully staffed team. Some of the key things to just note year over year in this. So to your point, Linda, into 2021, we received about $2.5 million for COVID-19 funding throughout the year. Those came in different increments and hit the budget at different times, but we did receive that funding. So far for 2022, what we have been notified that we're receiving is about $1.4 million. So it is about $1 million less for COVID response. If you'll remember, we did add, when we received our initial fiscal year 21 allocation of COVID, we did add 9 positions to the department for response. We are maintaining 8 of those into the 2022 budget and have made some adjustments there. Every time one of those is vacant, we do a really quick analysis of can we do without, how does that work? Because to your point, we only know that we have this funding through the end now of 2022, which would be September 30. We have received some indication that in 2022, there will be some funding that will be allocated in, potentially the first quarter of the new year. Some of that is still in the legislature to be approved. I do think it's very reasonable for us to expect the funding will continue to step down and at some point just not be there. So I wouldn't be surprised if in 2023 there is some level of funding. I would wager it decreases again. It won't be that 1.4, potentially significantly less. And then I wish I had a crystal ball because, we'd be in really good shape, but I would imagine we won't have it for after that. But it's public health and something else will be new at that time. So we do have this in here. Some of the things to note following our budget guidance this year, we are asking the county, this bottom under sources of funds, county appropriation. I think I can maybe, yeah, right here. Right here, you can see what we're asking the county for. So that is flat request to the county from our 2021 request. And you can see what that looks like from 19 and 20. At this point, in the next slide, we'll look at this a little bit more. We are projecting to add about $100,000 into the health department fund balance at the end of this year. I would say that that's probably a conservative projection and that will potentially be more. And of course, that impacts how we fill positions over the next 3 months. And then what we are projecting to put into our 2022 budget is that 947, that very bottom number. That is from health department fund balance. So in our 2021 budget, we projected and put into that the 856. So it's a little bit more than that, but we are going to end favorable at this year. So this second slide that you have, again, that's more just for your information to hold on to. That is just looking at the health department fund balance specifically and how that has evolved year over year. We, of course, never want to deplete that. We will continue to use that in this upcoming year budget. Think that that is prudent with the positions that we need to support, and our trend of actually adding to it after doing that budgeting. We'll continue to see, we are maybe more likely to use some of that funding in the upcoming year if no other COVID dollars were to come and we need to still support staff. I do think things like case investigation, contact tracing have many months ahead of us. And we'll continue to, of course, support our school partners and workforce partners throughout the upcoming year.
Just from an educational standpoint, utilization of these funds, if you had to use them, is that up to you, your staff's discretion, or does that go through the Board of Commissioners?
It would need final approval from the Board of Commissioners. So I think our process would be, if we're using fund balance, to come to you all with what that might be, an emergent situation, something like that. But it would ultimately go through county finance and the Board of Commissioners, like the budget process.
Okay, thank you.
All right, and then the final piece of the budget is our capital requests. These fall in different places. Some of them are partnered with other county requests, so you don't find them all in our specific budget I just showed you, but these are things that we have put in as a request for the upcoming year. The Niles Clinic we already talked about. We've just some other building enhancements. We've asked for the parking lot out here. I'm sure everyone has noticed, but we noticed it a lot over the first 6 months of the year being out there for vaccine clinic. It's a little rough out there. So we are hoping to have that improved. We have been very fortunate to have IS be able to support so we could be on Zoom, which has been really great. We would love to have this ability in our boardroom, so that as we transition back there, or just other meetings, we have a lot of different collaborative meetings and different things that would be nice to have more in a group setting. Sometimes our bandwidth doesn't support having 20 people across the department on individual Zoom, so we want that boardroom to be able to support that. And then the one that I missed on there is exterior signage and just some health department entrance. We actually don't have a sign in Niles. So we would love to have a sign on the building that says, here's where the health department entrance is. It is a separate entrance from the courthouse, so sometimes there's just a little bit of confusion there. So that would help with some directionality, pending funding available there, maybe adding like an awning or something. We do have folks who come on public transportation, and if it's raining or weather, just to have a little bit of that and just also designate like, here's where you come in. So we've asked for some of those things in the upcoming year. So that is the budget. Before I move over to kind of organizational chart, any questions there? So organizational update, and what I did keep this at is a high level of the kind of leadership levels of the department. I did not get granular into each individual program area. Happy to do that at another time, but I kind of just started high and then went over the positions that we have available so we can talk through those. So what you have here is our leadership and supervisory role structure. Every position that is bold is what would be on our senior leadership team, so our manager level positions, and then the others are part of our broader health department leadership team. There are more on that side, but the two red positions are our current vacancies in this area. So you can kind of just see how that all aligns here. CCHS, sorry it didn't fit, but Community and Clinical Health Services Manager, Candy. So that is what CCHS stands for. PH&P Supervisor is Public Health and Prevention Supervisor. That's Lisa Peoples-Hurst, who has been to meetings before. I'm trying to think if I have any other acronyms up there. Oh, and H&V, Hearing and Vision Coordinator. So apologies for that. Any questions on the org chart or any of those? I tried to show kind of the overall reporting of the health department too, and the county structure up there in the corner. All right. So when we look at our vacant positions right now, we are at about 12 vacancies. I think over the last month or two, we've held fairly steady at having 11. We've had a couple, maybe one or two that we've hired for, but then have had attrition, so have stayed steady at that number. You can kind of see where these fall in our area. So for instance, our family health programs area, they are running very tight right now and picking up a lot of different things. Our NFP coordinator, Jackie, has not actually left yet. We are searching for that position as much in advance as we can. It does require a Bachelor of Nursing, so it does take us a little bit longer sometimes to recruit for that role. Again, that's nurse-family partnership, so it's also not a clinical heavy role. It's more of a community service-based role. So again, that's sometimes a unique position to fill. Jackie will retire in early November. So we have had that posted and are hoping to be successful within a short time after she departs. Other positions on here that have been vacant for quite a while would be our EH, our environmental health sanitarians. I think those vacancies are going on over 2 months now. One of them might actually be longer than that. Those are just really difficult positions from, unfortunately, a pay equity and comparable across the county. We are a lower paying health department for our EH sanitarians, so we are looking at that. And it does require a bachelor in science and someone who really wants to invest in that. So we have, and we're not the only department looking. This is a reoccurring thing, but we have lost sanitarians to other health departments that do pay more. So we're continuing to look at that. I think this is a really important area of our department to really invest some of that time and analysis in. It has a lot of other links in our community and how we connect with the business community and economic development and aspects of that. So we are looking there. We are miraculously, it has been a long time. I'm actually really surprised. We only have a public health temp sub up there, but we have a full nursing complement. So we'll share the good as well. We're really happy with that. Candy is really happy with that.
It's great.
But we are seeking another public health nurse temporary supplemental. Again, just with flu season, continuing to do COVID boosters. We have been full and busy trying to get kiddos caught up on childhood IMS, and just all the other clinics are operating. We just continue to require that nursing support. And then I think actually our breastfeeding peer counselor has been vacant for quite a while as well. All right. Any questions on vacancies or positions? Candy or Jen, anything you would want to add there? Oh, Linda, sorry.
Well, the one I didn't really focus much on is the health officer. You're doing a terrific job of stepping into the shoes. But that does leave a significant gap in the team and
our administrative team is very busy right now.
Yeah, I know.
Jillian's eyes.
Yeah, I know. I just wanted.
Yeah,
I
absolutely.
just wanted to acknowledge that because I think it's very important.
Yeah.
So, thank you guys.
Yeah, I would just add to that. I'm just wondering when would they make some kind of a decision?
I think that would be a question for county administration. So that position, the health officer position reports to Brian, and I think there's a hiring committee. So that might be something to connect with Peg on.
It's been posted.
Yeah.
So I have not looked to see how many applicants we have.
Bob, I guess this would be for you. As we've seen at Spectrum, salary is the bottom line for our difficulty in retaining staff and maintaining a complement of staff. Is the county cognizant of the need for increasing salary and salary evaluations going forward?
Yes.
This is a very unique time, obviously.
We had a salary study done about 1.5 years ago. And when you step back and look at it, it missed some important parts of the county complement, like the road department and the sheriff's department. and they did not look at comparable positions in the community. So we're kind of stepping back and reassessing what we need to do. I think we just generally, when you look at even pre-COVID, the county was on the low end of the pay spectrum. And now with COVID, the county has 54 vacant positions right now, much like I think every other organization. And so we're all going to have to look at what we expect employees to do and what we're going to pay them and what the qualifications need to be. So kind of revisit a lot of that. And I think the other is that there are probably some, different expectations than we had in the past, countywide, that we're going to be looking at. So there's just a lot of things to get done.
Okay. Switching gears a little bit, I won't spend a lot of time on either, but I just wanted to make sure you all had general awareness, and then of course, just an update with COVID. I know you're getting those weekly updates, but we'll just do a quick high level there too. But two things that the health department is actively engaged in. The first is a little bit newer since our last meeting, but continuing to support, I guess not newer since our last meeting, but newer since we've talked about it in a while, is continuing to support the city of Benton Harbor and our partners there with the action level exceedance for lead and water, and then of course COVID-19. So just high level where we're at. So the city has had an action level exceedance since late 2018. So into early 2019 was the first action level exceedance. And that has continued. That was identified through some sequential sampling and different things in partnership with Eagle. Just a reminder there, I know that we're all fairly aware of that. But the health department is not a regulatory authority for public water supplies. Eagle is the regulatory authority for the city and municipal water. That being said, we are certainly aware and concerned and looking at resident health across many aspects all of the time. And so that is where the Michigan Department of Health and Human Services and the Berrien County Health Department step in, is when we have wraparound services that we can provide for awareness, education, outreach, and health monitoring. So through the work that Eagle did, it was really identified that it was lead service lines. Again, I know that this is not news to many. We have a lot of old housing infrastructure, but there is maybe a larger amount of lead service lines in the city, as well as other older similar communities. And then of course can be internal house lead fixtures. One of the things that we continue to want to get education out in the community are all of the exposure points for lead. Oftentimes we still, that is lead-based paint and old housing stock. We're continuing to do that education. We see that in our lead case management program. So this summer, I believe this is the 5th action level exceedance past the first for the city of Benton Harbor. Some of that was to be expected. It does take time for all of those fixes to go in place. So this does not mean there were wrong things happening. It's an ongoing response, an ongoing need that the city is addressing. So in the immediate, the health department has been supporting the city in provision of lead filters. So filters that are certified to lessen the risk of exposure to lead. Doing those peer, we have been doing that for a number of months and now a couple of years. Supporting a hotline, answering questions, trying to just really support enhanced communication with the city and being in lockstep with what is supportive to them. With that, there has been some increased look at just duration of getting corrosion control into place. The city has continued to work on that. That does take some time to become effective. And essentially what that is doing is coating the inside of the pipes so that lead does not leach out into stagnant water. So continuing to have those key health messages out there. And then most importantly, that long-term fix is actually replacing all of those lead service lines. And so you may have seen over the last handful of weeks, some additional funding has come to the city of Benton Harbor from the state of Michigan. We have a friend up here.
Yep.
That's all right. like squirrel, but okay. So we have had some additional funding come to the city of Benton Harbor for enhanced timeline on lead service line replacement. I think some of the original timeline that was looking at was maybe more of a 20-year timeline to get through all of the needs. It is expensive, there is time, and you need coordination of project management and professionals to come and do that. With the funding that has been allocated, the goal is to do that in under 5 years or even faster if possible. So there is an active response right now in a kind of a unified command setting of EAGLE. So the Department of Energy, Great Lakes, and Environment, Great Lakes and Energy, Michigan Department of Health and Human Services, the governor's office through the Freshwater Advocate is there. There's been some partnerships and support from the EPA. So the health department is a part of these conversations. Our role is to continue to support residents and make sure that we're getting timely and good communication out there, kind of be resident advocate. If we're hearing questions that are not getting answered in the broader response, to take that forward. We're going to continue to man our hotline. There is some activity around providing bottled water right now, while there's some ongoing just studies and different things to really continue to identify if there's additional sources or if anything else can be kind of added into that response period. So we are helping, again, with that communication. There will be some aspects of bottled water delivery happening. So that's going to come through our hotline. Our staff, we don't have the capacity to do the delivery, but we are working with state partners for that to happen. But wanted to have a unified response with the community. There's already a hotline out there. So we're continuing to wrap around and support that. As things continue to evolve, we'll continue to share that out. If you have questions, please feel free to reach out and ask, but just wanted you to know that we are still actively engaged in that. We are part of the budget for fiscal year 2022. We did actually receive additional funding to support action level exceedance communities. So we have had one FTE. Jeffrey Sims has been our specialist who has been helping with all things water filters, questions, and lead, and has done an amazing job. We are going to add a half-time health educator to that complement, just to continue to have good communication and continue to look at all the exposure points for lead and make sure that we're enhancing and promoting things like blood lead testing. We do monitor that through Guy's work on an ongoing basis. So continuing to have that whole picture. So we are excited in the upcoming year to have a bit more capacity there. In the recent weeks, the state has asked us to continue to identify if we think we need more support. So we will actively do some of that identification and see if there is potential to add more positions to that support.
I was just wondering.
Yes.
That EAGLE, what does those stand for? Environmental, I was just trying.
Environment, Great Lakes, and Energy. So it used to be DEQ, Department of Environmental Quality. I changed 5 years. Yeah,
Every
it's
new governor.
yeah. Right. New administration sometimes change the state department names, but water quality. All right. On to COVID-19. So I'm just going to do a quick high level of where we are at with slides. So when we look at our 7-day rolling average, you can see that we've kind of maybe started to come into a leveling or a plateau. We're kind of up and down at this point, a little day over day or week over week, but continuing to see where that is. We hope that is a true leveling. That would be really good. We have not seen a decrease yet, but have continued to see kind of that peak stop growing at this point, which is a good thing. When we look at that for our 7-day percent positivity and 7-day cumulative case rates, same thing. We have continued to see a little bit. We saw a week that was a dip, which was where we were hoping we would stay. It did kind of come back up after that, but again, we did not see an exponential increase. We did not see a significant increase. We have kind of met that leveling or a plateau. I think when we're there, it's really important that we continue to do all those right things, because that's what will keep us at that leveling and then coming down. But we are grateful that we haven't continued to see those higher increases week over week. Oops. So when you look at that, not in the graphs, just numbers, this top bar graph are just raw numbers. So those are the actual cases that were reported to the health department in any given week. And then this bottom is how that then calculates into the 7-day cumulative case rate. So just kind of showing what that balance is.
Continue high.
Yeah, it's kind of, it's something we're watching. Right now, we're just, we can't say that we're still on an upward climb, but we are also not coming down. We're just trying to figure out what, maybe if we're at that top of our curve. The other in there, and I won't go over each number, but I know there have been a lot of questions just of what does this look by age? Sometimes that's something to look at when we always look at percents and trends and averages, but just those rote numbers. So, you know, here in September, I think when we look at our numbers, we have had the most increase in our 0 to 11 and then 12 to 19. You can see that that has increased from what we saw earlier this summer. So just continuing to watch that. Oh, they're just a line. Yeah, yeah. So the headings, Jillian was saying, the headings are not correctly aligned with the rows, but the columns are there, yeah. So then continuing to work with our hospital partners, we have kind of come back down into the lower 20s to the upper teens, so that is good. Just noting with that our hospital partners are still just really inundated and busy. The ED is very busy. That is not all COVID. There are a lot of other respiratory things happening. But as we continue to watch, if there could be an outbreak or there could be a surge, it is important to look at that whole perspective. We know that our hospital teams are, I mean, they have a different surge capacity than they did a year ago. There are, similar to Dr. Edwards, I mean, no, you have mentioned this, but there are staffing challenges. So even if there are X amount of beds, to staff them all right now would not be a realistic feat. They have been very, very busy in the ED, and our hospital capacity has been high at this time. So when we look at our school isolation and quarantines, this is just an overall high level. You can see our current isolations, our current staff, or our current quarantines, those are divided by staff and student, and then cumulative. This cumulative is since the start of this school year, so that would be the August 30th date. So the next slide actually looks at this more week over week. School for the majority of our county did start on August 30th, so that 9/30 end week was the first week of school. The public health order for masking went into effect that second week. And then that bottom row was last week, so 10/1 ending was when we had that order repealed at the end of the week. We are going to continue to monitor this and watch this, be able to look at the differentiation that we now have between our schools. With smart sheets, I think we'll be able to bring maybe even more granular of area to area or district to district. I think that will be something that will meet lots of questions that we've had. So we are very, we're looking forward to that. I think that tool will give us a lot more analysis capacity than we currently have. So we are looking at that. One thing to know, if any, on RESA's website, there is a public available dashboard there too that shows at any given time all of the cases in a school district. So it is still a requirement from the state of Michigan that schools report how many active cases they have in a school at any given time, as well as overall cases they've had for the school year. So RESA does support a universal dashboard for that, and that is available publicly. We can make sure that link gets out, but if you go to their website, it's pretty, yeah, it's on their homepage, so that's pretty quick to pull up. And those are the slides that we have. Right now, we're really active with booster shots. We are seeing our clinics pick up again and having more folks come in for that Pfizer booster. We still, of course, are looking and waiting to see what we're going to hear about Moderna and J&J, but we have had more active clinics again. I don't know what last night ended with, but the week before we were closer to 90 again, and we had been in the 20s for some time. They are primarily booster doses we're seeing people come in for, but also some initial doses too. So that's good. I don't know what last night ended as. It was busy, but I didn't get those final numbers.
I was curious about your flu clinic volume, your flu shot volume.
So I don't know that we've done a ton yet. We are hosting a county flu clinic this year, and we have flu appointments coming in. This week, I believe we have started going to some of our senior living centers. I'm hoping that we have a high uptake of flu. We're going to be doing some communication around that. Spectrum Health Lakeland is a great partner in that too, and has been hosting some community clinics. And between the Spectrum Health Lakeland team and our team, we do pretty much blanket all of the assisted livings. The skilled nursing facilities usually do flu shots partnered with their pharmacies or their providers. There's some state wraparound this year trying to do flu and COVID boosters unified for those facilities. We try to go to some of the independent apartments and other places where folks might not get out as much, and that's kind of balanced between our teams and Spectrum Health Lakeland.
Thank you for the good report. Any questions? All right. Dr. Harrison, report from the Board of
I'm
Commissioners.
smiling, so it's. So, like with the health department, things have been very interesting at the county board. We did get the resolution approved. It was tabled rather than talked about at the last board meeting. So that for the staff support for training. So I'm very excited about Guy taking the GIS program through Loyola. The other, I suppose, the big news is the years ago, Ken will remember this, during the mergers, Lakeland was formed and Berrien General and the Berrien campus became part of Lakeland. There was a reverter clause in that transaction. So now Lakeland probably wisely has said, here, why don't you take it back? And so the county's starting to look at what does that mean? Because it's the infrastructure out there is a problem.
Lacking.
And so because the juvenile center's out there too, it really is a critical thing for the county to sort through and figure out what appropriate actions are necessary. So it's one of those, you got a gift and you really don't want it, but now you got it, you got to deal with it. So, so I think everything goes around, comes around. So, that would be, I'd be glad to answer any questions that you might have.
All right, seeing none, thank you for your report. So now.
I'm sorry. When you talk about GIS, is that the computer?
It's a geographic mapping. So there's Loyola Chicago has a unique program, unique in the country, where you can look at health data on a geography basis. And so Guy, the epidemiologist, will be attending that program. And so, because we have a big department, a GIS department that helps realtors, property owners look at where they live, and if they're buying a property, what's it mean, who's their neighbors, and so it's actually very interesting. If you like pictures, it's very, very interesting to look at.
There's a lot of great uses for public health. I mean, part of that will support dashboarding too, just data sharing. And I should have said that with the COVID data. We have taken down our old dashboard. It was, again, put up in kind of a static fashion.
Right.
And the titles couldn't be updated and it couldn't be updated anymore. But we are moving through the steps to put up a new dashboard that actually has a lot of additional data points on it. Guy with this skill set would be able to do more of those updates in-house so that we don't get to this point again where it's static and not relevant. Also supporting environmental health team. There is a lot of benefit to having that capacity to support Nick and the team as they're going out and doing well in septic and like just surveillance and understanding what that looks like in the county. So that will be really nice to have.
I think the one upside of COVID is that it showed that a lot of the decision-making infrastructure for public health just doesn't exist. So, virtually every meeting, there's a very reasonable question, but the data sets don't give the ability to analyze and make a prudent decision. So not just locally, but at the state and federal level. And so I think there'll be a retooling of things like smart sheets and GIS and things that will help deal with these as they come in the future.
And so what's the timeline for?
Well, I guess it's how, I'm not sure.
So the
when-
dashboard work we're working on this fall, we will actually hope probably at our next meeting or between, we'll do that with a contractor. So we're looking at someone to support that. Guy has already started the GIS course that was mentioned. It does take a handful of months. It's an intense course, so he can do that, but it's underway. He has started that. In the meantime, we're working with some partners who can kind of keep us moving while we're building that internal skill. And that is true. I mean, the infrastructure just hasn't always been there. I mean, not every health department actually has an epi that has a guy to do some of that stuff as well. And so many departments who don't have that have to rely 100% on like a state dashboard or that state data. So it is very nice to be able to look even at that more localized level.
So is Guy gonna be doing all of this by himself? or-
No, he'll be part of a broader team. We won't make him do it all by himself.
Okay. I also had a question about the computer system. You were saying what's about updating that.
Leaving the mainframe to the specific programs based on the different departments. That's still in process. At the county board, the question was whether the renovations to the jail would be done before we could leave the mainframe. So as a good example, Lakeland got rid of its mainframe back in I think around 90. And in Niles, we moved off of our mainframe in 85. And so we're just a little bit behind on that. But that work, and it's being done department by department, so it does take a long time, but the clock is ticking on how long the mainframe will be.
I'm sorry, Mr. Harrison, I wasn't clear on my
Oh,
question.
I'm sorry.
But that's good to know. But I was wondering, you were mentioning once upon a time that for the whole community, like a satellite type
The
of.
broadband?
Yeah, the broadband, I'm
Okay,
sorry.
sure, that's, actually, I think there is some good news on that there'll be more federal and state monies to support local communities for broadband expansion. It's part of the infrastructure bill that's tied up in Congress right now. And so here at the county, with some of the COVID relief, re-energize the economy, we're looking at local units to do some matching for things like broadband or water systems or other things like that. So all within the restrictions set forth by the state and the federal government. So that's really not all clear yet, but at the federal level, broadband it's talked about all the time now.
Yeah.
So, along with, bridges and roads.
Right.
And they always mention broadband.
Okay.
So I think it would be really a big step in the right direction.
That's it for me.
Okay, Ray, did you have a question? as
Very
well?
question for Jillian. With our dashboard down, where is a good source, authoritative, accurate, up to date, to be looking for what we would have in our dashboard?
We have those all linked on our website. We share them every single week on social media as well. Anytime we make any commentary on the data, there are two sources of information that can be found through the state's website. One can be found at michigan.gov/coronavirus. That is where they have their main data dashboard, and you can find more detailed information about outbreaks that might be occurring in a long-term care facility or in a school, for instance. They also have another tool called the My Safe Start map. This is one that shows the CDC indicators and thresholds for community transmission, as Courtney had demonstrated earlier. So you can look at that case rate per 100,000 population and that rolling average or that cumulative average for the percent of positive tests. There are other dashboards out there. They pull their information from a variety of sources, so it's important that whatever you're looking at, make sure you know where it's coming from. We always recommend that people are looking at the state or the CDC's website for that data.
Jillian, does the data use the same data points and do they measure the same way, or is there going to be some possible dissonance?
Yeah, there is possible dissonance, so that's why it's always important to read those footnotes. The state of Michigan is always pulling their information from the same sources that we feed up into.
Right, okay.
So those are going to be the most accurate when you're looking at that local level. And then similarly, the CDC is pulling directly from state information. But there is always that possibility that timing can make a factor depending on what time of day you look at the website. But if you're looking at like the New York Times tracker or covidactnow.org, or I mean, there's a variety of other sites that have been stood up over the pandemic. Just make sure you're looking where that data is being sourced from and then how often it's being updated. And that usually explains for any discrepancies you find.
One common thing that you'll see between the state and how sometimes our numbers are, when you look day to day, is when you'll see some of that timing fluctuation. Usually when you look at the week period is where that smooths out. For example, we look at a lot of our data by referral date. So that is the date in which the case comes into the health department, where once we've done that case investigation and done our work, that's in MDSS. The state most frequently uses either the symptom onset date, or if it's an asymptomatic case, the test date. So that can sometimes from a timing perspective have cases a little different throughout each day, but usually that smooths out over the week. I mean, that's another reason why we don't ever take one data point alone as a thing. You really want to look at that overall trend. You want to look at multiple data points over time. It is never looking at one singular thing, because you have to look at those footnotes, look at the timing, and understand that you can't look at that in a vacuum.
Sure, absolutely. Thank you.
All right. Is there anything else that the board would like to discuss before we move on to public comment? All right. So it's time for public comment, and we're ready to hear your opinions, your concerns, your complaints. We're open for you to share your information. However, we will not tolerate any communication which appears to scare, frighten, harass, molest, terrify, or abuse our department staff or the
Gets
board
inside
members.
those parameters.
So you're welcome to free speech, First Amendment in the United States, and the Michigan Constitution. We advise that not all speech is protected, and could you just wait a second so I can?
Sure.
Yeah, I look forward to your comments, but we don't want any threats, and if you'll be asked to leave if there are threats in what you say is your public comment. So each individual is welcome to 2 minutes to share. We'd like to have your first name and last name and the city of residence, if you would share that. So we would welcome that. So thank you. Please come up.
Thank you. There you go. You've been last.
Yeah.
I want to thank you very much, Board, Mrs. Conrad. I think I recognize my own commissioner here, Bob Harrison. Hi, I'm one of your constituents. I'm Jennifer, and I live in Lakeland Charter Township, and I thank you so much for being here in person. It's great to, as neighbors, be together for this. I only have 2 minutes. I'll be as brief as I can, and what I'd like to do is help you, because I'm seeing an image. There's 2 Berrien counties currently. I think there's the terrain theory, Berrien County resident. There's the germ theory, Berrien County resident. And we're all supposed to be unified together. I think we would all agree that Spectrum Health, the hospital system, every practitioner in this county would agree, we need everybody, all hands on deck on this county on the same page as much as possible, spiritually, emotionally, helpfully. So that's the spirit in which I'm going to bring my 2 suggestions. My first suggestion today, and I think this would gain yardage. My friends behind me, neighbors behind me, I'm just saying we're in a way like soda bottles shook up with that cap unscrewed. And there's tension and anxiety in this community because this very body has been seen as an aggressor against our friends and neighbors who've been trying to run businesses. So I want to help that. I want to help you uncap that soda bottle. If you have an 8-year-old son like I do, they wang it off really fast. It's a mess. It's a disaster area. I want to help you to ease that pressure so that we can get back on the same page with 2 specific requests that are measurable, that I think are easy for you, and that would maybe show our paradigm, if you want to call it, that we're on a different paradigm, as many of you perhaps, that we are also welcome in this county and you're not aggressors against us. So the first request is, we've seen great charts. However,
Thank you.
we're seeing COVID positives without PCR
Ma'am.
tests.
Thank
The
you.
PCR tests need to be cycle threshold numbered. We need to know those numbers, Commissioner Harrison. We need to know those
Okay.
numbers in addition. So we
Ma'am.
know those are truly positive.
This is your 2
The
minutes.
second thing that is specific and measurable that I think can help is, and you're interrupting me, I'm forgetting what it was.
So we would.
I came here in a spirit to help you, and 3 minutes wasn't enough. So
So you're welcome to talk with the staff after the meeting if you would like to, or I will be available. Thank you very much. Thank you.
My name is Robin Graffinius. I'm from St. Joe, and that lady was much more kind than I am. I've been waiting for this opportunity to tell you how disgusted I am by your hypocrisies. Bob Harrison, I cannot believe you. You go to the county commissioner meetings unmasked, but you walk in here with a mask. What side of the fence are you on? What do you really believe? You sat there while we begged and pleaded to fire Courtney. She has been nothing but a menace. What this lady said is absolutely true. I'm not calling her names. I'm not calling her names. I'm not threatening her. I'm not threatening her. I'm not breaking any of your rules. And you're wasting my 2 minutes. I would like to know, Courtney, in an email, and here's my email address, I would like to know where you got the 50% drop in mask because of the mask mandate. I'd like to see those numbers because those charts that you just showed us do not reflect any of that information, but you were quoted in the newspaper for your side saying that there was a 50% drop. So I would like some explanation about how you got that. And I think you should be quoted in the paper for that too, so that the general public can actually see the reality of the situation and not just your drummed up numbers. I am very angry that our children had to be masked. And I think it's disgusting that when we came here to protest last month, we looked in the windows and saw these people in here working without masks on. Not just in their offices, mind you, walking around in the open spaces in here. But our children had to be masked at school. It's disgusting. You need to practice what you preach and not send our children who are at very low risk of being sick. Even if they get the virus, my son tested positive for the virus last year. He had a sore throat for 3 days, never had a fever, never lost his appetite, nothing. Why don't we look at the number of illnesses and the number of hospitalizations among the children and not among the cases?
Luke Andreessen, St. Joe. 0 deaths and 1 hospitalization, 0-19 age group. I said that last time. Yellow all summer and fall. This is from internal documentation. I've had over 40 nurses come to me and doctors from Lakeland, whistleblowers. You want to know why there's going to be some problems coming up in the fall and winter? Because 43% of them aren't taking this lethal injection. Why aren't they going to take this? Why is that? Well, maybe it's because it's a trial until 2023. This is a lethal injection. Robert Malone, the inventor of the technology, for 30 years, since the 90s, he's been telling people this stuff is dangerous. Do not take these injections. You're advocating for something that has, in the religious community, that has a patent WO2020060606 that contains luciferase. Are you kidding me? With the 666 mark of the beast contains fetal cells, aborted fetal tissue. You're advocating for that, for religious people to take that? Disgusting. None of you have done any of your research. PCR, polymerase chain reaction test, Kerry Mullis, the inventor of the test, said it's not a diagnostic tool.
Just post the numbers.
Not a diagnostic tool. 40 cycles. That's how they got this pandemic to go. You guys are using all of this against each other. None of you even know any of this stuff. That's a SARS-CoV-2 patent number, 2015. The original patent was in the Dutch patent office. 2017, they did it in the US. SARS-CoV-2 was patented in 2015. This is a giant plan. How do you people not see this? Do you not understand what you're a part of? You're a part of a totalitarian dictatorship taking over the world right now. Have you seen what's happening in Australia? COVID camps. They've completely brutalized their entire population. They're suffering. They got no weapons. At least we've got weapons here we can defend ourselves. They got to go into the streets now without weapons to defend themselves. They're locked down to their homes. This is what you're going to bring upon our people. You realize what you're a part of. I fought for this country. I went to war for this country, and I'm defending the people and the Constitution right now against you. You are all tyrants because you are engaging in tyrannical dictates.
Thank you for your.
You will be held accountable. We will have Nuremberg 2.0 very soon.
Thank you.
We will not forget what you've done to these people.
Thank you.
We will not forget.
Thank you.
Follow the money. You're getting a lot of money for this shit.
You're only getting my first name because last time I spoke at a board meeting, I had vandals come on my property and vandalize things. So I'm not telling you who I am. I live in Berrien County. My husband is on a board of education. I am really upset that you are keeping this quarantine thing in place because Courtney knows it doesn't work. I am so disgusted. Coming home from Arizona last year on a 20-hour trip, my husband kept getting phone calls from parents in our district saying they told me to come pick up my kid at the middle school. Half hour later, they told me to come pick up my kid at the high school. They're all being quarantined. This is the second time. They didn't get sick. So I said to my husband on this long trip, how about if we ask the $150,000 question? Call the superintendent and say, how many of these kids in quarantine are getting sick? I was expecting maybe 5, maybe 20, who knows? Out of all the kids, and this went all the way to June because we kept asking once we started, how many kids quarantine got sick? 0. Now, if you're going to quarantine kids, I would say you need to have data that shows that it's actually working, or A, that it's actually needed. You don't need quarantines for these kids. The mom was crying on the phone. My kid is a boy. He doesn't do well, staying home for 2 weeks, missing his math class. I don't know if all you guys know this because you're all pretty old. Maybe Courtney does because she doesn't look like she has enough experience to do this stupid job.
Please.
But don't stop. Don't interrupt me. That's a descriptive form. That is not a threat. Don't tell me I can't say it.
Don't threaten our staff.
I am so tired of the fact that you guys don't understand that these kids in school are learning what we learned in college. For a kid to miss a math class that is Calculus 1 when he's a junior in high school is devastating. He can't do it online. He can't do it at home. His parents can't help him. It is ridiculous. You're destroying our kids and you know it.
Thank you. All right, this lady was first. Okay, welcome.
Hi, my name's Terry, and I live in Eau Claire. And I have a son similar to who she was talking about. It's my son's last year in special ed through Berrien Risa, and I'm here actually representing him because he's essentially nonverbal and has autism. He was recently exposed to COVID in the classroom. His exposure was through a vaccinated staff member. He's unvaccinated because we feel as parents that he may have been vaccine injured as an infant and a young child. And so it's our prerogative not to vaccinate him if we're fearful about that. In the classroom, if you're unvaccinated, you are expelled or you have to quarantine for 10 days. If you are vaccinated, nothing happens. So you get to stay in the classroom and you're observed for symptoms. And I don't really understand that discrepancy. It seems like you can spread it and contract whether you're vaccinated or not, But if you are vaccinated, nothing happens to your routine in the classroom. And if you're unvaccinated, you're expelled each time there's a positive or there's symptoms. For him, it's very hard to understand why he's being excluded. So it's frustrating and it upsets the entire family. I talked to an administrator about it and about natural immunity, and he said at this time they're following Berrien County Health Department recommendations. And he said Berrien County Health Department is not looking at natural immunity. And I just wondered about that. And he also said it's more likely for an unvaccinated person to spread it to a vaccinated person, according to the Berrien County Health Department. And so I just needed clarification on those two issues.
Thank you for your question. Welcome.
Hi, how are you?
Thanks for coming.
My name's Amy Foster from Lakeland Township. First, I would like to say I'm glad that Courtney Davis was forced to rescind her unlawful mask mandate in the schools. Yep. We tried in good faith to reason with her in this board and suggest improvements to the data being used, but it fell on deaf ears. I suspect her decisions in Berrien have more to do with Lansing than what is needed and wanted in our county. I still have problems with the non-scientific and discriminatory nature of the quarantine advice that the health department is giving schools and they are using. As Dr. Anthony Fauci once wisely said, in all the history of respiratory-borne illness viruses of any type, asymptomatic transmission has never been the driver of outbreaks. The driver of outbreaks is always a symptomatic person. Therefore, why do you still insist on quarantining the asymptomatic healthy children? Worse yet, you're continuing to treat the vaccinated and unvaccinated students differently in terms of your quarantining recommendations. There is no scientific basis for this. It is foolish to continue to try to pretend like the vaccine is effective. Not only can vaccinated individuals get and spread COVID, but it does not protect from hospitalization and or death. The most recent technical brief by the Public Health England shows that overall in 2021, 70% of deaths were in partially or fully vaccinated individuals. Our healthy kids have a right to their education, and it is wrong to deny that them based on hypothetical possibilities of contracting COVID based on specific footage, vaccines, or masks. Also, we as the public have grave concerns not only of the poor job that Courtney Davis is doing in her role, but with the members of the Board of Health. The fact that you unanimously supported her erroneous decision reflects poorly on you. We want to know more about what makes each member of this board qualified to advise or vote on the health decisions in our county. For instance, Ms. Stroll made it evident in a meeting that I attended in August that she was completely unaware that students were in person last year. How does a board member sit through meetings all throughout the last year's school year and remain unaware that they were attending school in person? Also, I am aware of at least one member of your board that I personally talked to who was against mask mandates logically and morally, but went ahead and voted in support of Courtney Davis's mandate. How sad is it when a person goes against their own beliefs to support a political school mask mandate? Thank you.
Welcome. We're looking forward to your comments.
I'm a resident of Berrien County. I'd like to know the numbers for last year for all causes of mortality, and you can send that to anybody who's willing to give their name and email. I have a quote here from C.S. Lewis. Of all tyrannies, a tyranny sincerely exercised for the good of its victims may be the most oppressive. It would be better to live under robber barons than under omnipotent moral busybodies. And that's what you guys are being. You're being tyrants. Shame on each one of you individually and corporately as this group for what you're doing to kids with the quarantines that are not sick. You should all resign in shame immediately and stop what you're doing. There's no reason, and you know it, there's no reason why to have a kid who's not sick, not presenting symptoms, to be quarantined and sent home from school. Money. That's crazy. That's crazy. If we need to protect people who are vulnerable, the hospital system is there to support our freedoms. We should not be sacrificing our freedoms for the sake of a hospital system that is overwhelmed because they're running their own staff off. Yeah. Right. Stop the insanity. Stop it. Yeah.
Hi, I'm Lori Nitz. I'm from Broda. And I first want to thank you for the job you do. I know that it's hard, but I want to know why more preventative measures aren't taking when a person, to prevent COVID, first of all. I don't hear any of the health department giving these measures except for stay home, mask, whatever. And I don't hear, when people call their doctors, they're told stay home unless your symptoms get worse, then come to the hospital. You need to give them preventative things. There's vitamin C, D3, zinc, magnesium. They can be taken to help if they get sick. They don't get hospitalized for this. And there's there's studies on hydroxychloroquine, there's studies on ivermectin, and people downplay ivermectin, but studies have shown where ivermectin, when patients have been given ivermectin and been given plasma, the ones who have been given ivermectin have combated the symptoms quicker than with plasma. They kind of even out at the end, but why aren't we giving this? I mean, if things have worked, why do we wait until patients are sick, so sick, when they get to the hospital, the only things they can be done is put on a respirator and given this awful remdesivir. It kills people and it tears down their organs, and it is not good when people have underlying symptoms. I just want to see more preventative things told to people. I mean, health department, you should be telling people to take these vitamins. I'll donate vitamins to people. I know you do a good job. I know what you have done in Benton Heights because I was there. I just want more of this done, more preventative things shown, and more taking responsibility of treating people. Thank you.
Welcome.
Hi. My name is David Nicolation. I've got two granddaughters that go to school here in St. Joe. I have a situation at home that you want to hear the height of stupidity is I've got my daughter that works for Spectrum Health in the medical billing department. Well, the medical billing department has been having their workers work virtually from home since March. So now this last week we got, I think it started a couple of weeks ago. They told her that she was going to have to get vaccinated. She isn't vaccinated. The kids aren't vaccinated. And you're never going to get those kids vaccinated. Not if I got anything to say about it. Right. And so now they're telling her that if she doesn't get the vaccine within a 14-day period, that they are going to assume that, or they label her as a voluntary resignation. Yeah, I'm just looking for an attorney and I can't find one yet, but I will.
I got 2 names for you. We got names for you. All right, thanks.
Hi, my name's Pam Hoover. I'm from Stevensville. I guess I am on the side where I feel that it is very sad that the vaccination is being pushed on everyone. I know more people that have been having COVID after they've been vaccinated than without having the vaccination. And it's very sad to see that this is now progressing like he said, in the hospitals. We're making people lose their jobs because they're not vaccinated. Well, you guys should know all the statistics, and you're still pushing this on people. It should be freedom of choice. Whenever have we seen when you walk into a store, Meijer, Walmart, anywhere where they're acting like this is Disneyland, come get your free vaccination. Really? When have they ever given people money to take a vaccination? I will give you a bonus to take a vac. Come on, guys, wake up, wake up. Yeah. Why are you promoting that in churches? That is, like Lou said, really, that's sickening. That makes me sick that we're promoting this to people, that we're pushing this on other people. It should be freedom of choice. If we choose not to take it, we should not have to take that shot. We should not have to wear a mask. Freedom, America. Come on, guys, you're gonna be communists before long. You're gonna turn around and you're gonna wonder how you got there. Well, shame on you, because you know what? This is it right here. This whole thing right here, not standing up for your rights, not standing up for freedom. Freedom is where we started. Freedom is where we need to go.
Well,
Thank you. Jennifer Mayo. My email is on here if I could get a response to a few of these things. I was wondering why Mr. Miller is no longer in attendance of these meetings. I think if we're going to go through these statistics, which are kind of confusing, especially when you have multiple data points on the same graphs, that if we could have the person who's actually compiling that information available to explain them, that would be more helpful. I wanted to address the faith-based partnerships that were mentioned earlier, and I would like to specifically know if those faith-based partners are receiving any kind of incentives for having clinics at their locations, either monetary or otherwise, either from this department, the state, or from federal agencies. So if that information could be compiled and emailed to me, I would appreciate it. I also wanted to address the nutritional and nutraceutical things that a few other people have mentioned. We're a year and a half into this, and I haven't heard anything from this department besides wash your hands and stay home and wear a mask and don't breathe on people and stay 6 feet apart, wherever that erroneous statistic came from. Why are we not seeing more on different nutritional things that we can do? And have you discussed with the schools, because you seem to be so concerned just about kids in schools and maybe not about the rest of the community, but why are we not having nutritional programs partnered with this agency to make sure that we have 100% organic whole foods in the schools and removal of all processed foods? Because if you really cared about our kids' health and their nutrition, we should be doing that. There should be a very strong partnership between this agency and the schools to make sure that we're making those kids as healthy as possible, not just by washing their hands. I'd like to know if antibody testing is going to be added to the repertoire of things that that you do for the quarantine. Thank you.
Thanks. Welcome.
Thank you. My name is Sean. I live in St. Joe. And I guess, Courtney, you mentioned that you had no right to mandate masks for K to 12 or whatever at one time. So I guess I want to say, what changed your mind? Was it the local superintendents couldn't get the job done? So then all of a sudden a phone call was made. Who do you answer to? I mean, did you get a call from Lansing? I'd really be interested to find that out, because the numbers and the science weren't backing that, first of all. Second of all, I'd like to know, ever since you made us the kids mask, where are the numbers of the kids with this RSV? I'd like to kind of know, has there been any studies done on the taking back into the carbon dioxide, of breathing your own carbon dioxide every day? Is there studies done on that with Spectrum? I mean, Spectrum is so involved. I'd like to hear if there's people that are reporting to their kids, taking their kids to the doctor's office, and if there's end results of wearing these masks 24/7. I feel like that's how it is. My daughter came home the other day. She's getting acne across her face again, and she's not very talkative. She doesn't say much. But she said, "Dad, I'm over this mask thing." Our kids are the ones with the lowest number. They have a 99.9% survival rate. Okay, if anybody gets it. Okay, I don't get why we targeted our kids. I think I have my theories on it. Is that you can't get to the adults anymore because we're ticked.
Yeah.
And now you're going after our kids and you're targeting our kids.
Easy targets.
And I'll tell you what. I mean, everybody talks about the mama bears. Dads get pissed too.
Yeah,
and I'm awful pissed right now because my daughter's got to wear her mask between 8 to 10 hours a day because she does play volleyball after school, and so she's got to wear it for that too. And I think it's horrible what you've done to our kids.
welcome.
Morning, everybody.
Good morning.
Hi, my name is Victory Woodall. I've been here a few times before, so you probably know my face and my group's face. I'm part of a group that represents about 2,800 people in Berrien County, mostly parents. And they've come on the group even more since the mask mandate started, and even some since it was rescinded, because people are waking up to all this. I want to draw your attention to an email I received from Jenny Fee, the superintendent of St. Joe Schools, where my children attend. We went to the board meeting Monday night, and they announced the new quarantine policy. So I asked her for a clarification and a write-up on exactly what it was, because we didn't really catch all the details as they gave it verbally in the meeting. So her reply to my email said, Dear Mrs. Woodall, for the past month, we've been encouraging the Berrien County Health Department to modify its quarantine guidance to align with practices being utilized by the Kent County Health Department. And she goes on to say how she received it verbally. That's why it's not written up. And she gave me bullet points. So I want to know why you guys are taking advice from schools. Why are you changing your policies based on encouragement from local school officials? That doesn't make sense. If you're truly the authority on health and what's best health for our children, then why are you taking advice and, caving to it, And I also want to know why, you put the almighty dollar ahead of what's supposedly best for our children with the mask mandate, because you literally pulled back your mask mandate at the threat of losing money. So we all know what the bottom line is here. It's money, and we understand that. So we know how to fight better now. So we're gonna probably go the money route and see what avenues we can pursue with that. The other thing is, ma'am, when you're on your phone, the camera's right behind you. We can see you scrolling through your texts. My friends who are watching live could see what your passcode is. So you might want to change that. Which is really disrespectful when you're supposed to be listening to us to be scrolling on your phone. I want to say also that the hospital is not in crisis mode because of COVID, and you all know that. They're in crisis mode because of staffing. So if you could help them address that, that'd be great.
We welcome comments. Are there additional comments? Welcome.
Good morning. My name is Melissa. I live in Benton Harbor, St. Joe Charter Township. First of all, thank you all for doing what you do. I'm sorry that you're going through all this. I do appreciate the fact that we have differences of opinions. However, what I'm hearing is that we want opinions, but only if they agree with ours. Now, maybe we're all guilty of that, probably all to a certain degree. However, as you gave your reports this morning and things, and being accused of taking the mask mandate away because of money, I'm not sure anybody really listened to everything that you talked about this morning that this health department does for the people of Berrien County, from birth through death, all the things that have happened. And so, yes, things are getting out of control. I'm sorry that some of you have been threatened. I'm sorry that some of you have been threatened to the point that you've had to notify the police. I'm thinking that very aggressive to you when people say that we know where you are, that we're being accused in religion, and that really it's gotten out of hand. And yes, well, somebody did say we should all be working together. We should all be working together. I don't need any comments from the peanut gallery. Thank you. So, and besides that, of being rude and talking under your breath while other people are talking is very rude. I did teach for 26 years. I taught first graders most of those years, and they're resilient. And I am also a parent, and I would do anything for my child, but I would not put my child in as a pawn. And that's what is happening. So thank you all for doing what you do. Thank you all for doing what you do.
So if everybody's done, do we get to make another comment?
No, one per person, thank you.
We'll talk to
Two
them
minutes per person. We have one more person coming up at least.
You did say you're all sticking around, so if we want to talk to you afterwards, right?
That's correct.
All right, awesome.
I can't speak for the other board members, but I'm here, yes.
You got this.
Some of us work, so.
Yeah, some of us do too, but not shut this down.
Thank you. Yeah, so I just want to say real quick, sorry. I know there's a lot that needs to be, people need to talk and stuff, but I just want to say, I think you, on a different subject, I guess, as as we drive around Benton Harbor. There's a lot of the construction. Sometimes you have to go down different roads. That I just want to say thank you that that all the money that's been put in to changing all the pipes out. I know that's something that I just want to say thank you for that. It's an inconvenience for us sometimes, but it's gonna be new roads, new sidewalks. I love new sidewalks. And being in a chair, I just honestly thank you so much for all you do with the water system situation that was here, and just getting all that fixed up. And so thank you. All right.
All right, are there additional comments? Are there any additional comments?
I do.
So respectfully, if you have had your 2 minutes, thank you. All right, seeing no additional people, the meeting is adjourned. Thank you.
Courtney, maybe